Good morning, everyone. I'm Dr. Satpal Singh Shekhawat. I'm a GP at Curtin Lindsay Surgery, and I'm also the Medical Director for NLCCG. So this is just a short video of how we can use Arden searches to help us review and identify our at-risk patients. This is the work which we'll need to do to search and find out the patients who have been centrally selected, and then see whether they have got any patients who should not be on the list, and if there are patients who should be on the list, and that's what I'm going to show you now. So to run a search, first you need to do is click on reporting, go into clinical reporting, and in that you select the Arden's limited searches. So you open that up. When you open it, you'll see an alerts tab. So you open that one. You go into the COVID-19, and there are about 40 searches there. Now, when you search them, if you scroll down, you will find this search, which is COVID-19 alerts review as high risk recorded centrally. And as you can see, I've already run this search for our practice, so that we've got about 2.3% of our population, which is 243 patients. But if you hadn't run it, all you need to do is you right click on this and you click run, and you will get a list. And once you've got the list, so once you get a tick around this, which means the list is the search has been run, then you can go into show patients, and you'll have the entire list of your patients in front of you. I'm not going to do that for obvious reasons of patient confidentiality. Now I'm going to go into a test patient, and that is just to show you what then you can do with the use of the template. So for this purpose, I'll use the elderly test transfer patient, and when I'm in the notes, this COVID template which we've got, in this you can look at the risk tab. So once you've selected it and you're reviewing patients, as you're reviewing that list which we have just shown how to do, so for example in our practice those 243 patients, so if I'm going through that list to make sure that the current and correct patients are on that list, we can then use this to code them properly. So as you can see at the bottom, you've got the 6 criteria, so you don't have to keep flipping between the screens. You can see who needs to be in this category, and you can check with that patient. You will be then able to read code. So if you click this, they are high risk, then that would be okay. You can look at the advice that consultation should be remote initially. So you can select all these read codes for them. And if you need to do a letter, so for example, there was somebody who was in low risk and you needed to move them to high risk, you can collect, and if they haven't received a government letter, you can send them a letter. Now, if you felt that this person is in high risk but actually should be in moderate risk, then you click on that and you save it. So Ardens is strongly recommending that you don't mark in error the centrally inserted code, but you use these buttons, and you can do with low risk as well. Now, the work for moderate and low risk is not in the highest priority at the minute, so I would urge that you focus on the high risk category patients. So once you've done that, you can then save, and the data will be coded. So I'm not going to do it on this because it's a test patient, but that can be done. Now, just to show you guys, we will be sending you a video for EMIS as well, and along with that video we will be sending you this user guide. So Ardens has done a step-by-step guide, so if you don't have the access to the video, you can still run through the steps here and change the coding. Once we've done that, the next steps for us will be the alerts for high risk patients, and then obviously we can work through the flu register and so on and so forth. So thank you for listening. I hope that was useful for you.